Clinical trials can open the door to tomorrow's care, but only if patients can find them, understand them, and trust them.
We're Sciana, Cohort 7.
Ridhal Agrawal, Raquel Correa, Judith Dios, Claudia Shade, and Andreas Welker, exploring trust and accessibility in clinical trials. Today's conversation is an AI-generated interview, based on written notes provided by a Swiss cancer patient organisation, bringing in the perspective of patients and families navigating cancer care. We're asking, how do we move beyond seeing trials as distant experiments to making them visible, voluntary, trustworthy, and practically accessible from the patient's point of view?
Welcome, and thank you very much for joining us. Today, we would like to talk about clinical trials from the perspective of a cancer patient organization. We are especially interested in access, trust, communication, and the barriers that patients may experience.
Thank you for inviting us. Before we begin, I think it is important to clarify our perspective. We do not plan, develop, or conduct clinical trials ourselves. Our organization supports cancer patients and their families throughout different stages of the disease. We also support cancer research in several fields, including clinical research and trials. So the answers I share today come from the perspective of a patient organization, not from a trial sponsor or study center. Some of what I say is based on experience and assumptions rather than formal evidence.
That is very helpful. Let us begin with the patient pathway. How do patients in Switzerland typically find out about clinical trials?
Most patients probably find out about clinical trials through their treating physicians. The doctor-patient consultation is still the most important entry point. Patients may also receive information through university hospitals, specialized centers, patient organizations, trial registries, or direct internet searches. But in practice, the treating doctor often plays a key role.
So access depends quite strongly on the clinical setting.
Yes. Patients usually enter clinical trials through university hospitals or specialized centers that conduct clinical research. Cantonal or private hospitals may be less involved, depending on the context. Important institutions include treating physicians, university hospitals, universities, study networks such as the Swiss Cancer Institute, and clinical trial units at hospitals.
From a patient's perspective, how much depends on the individual clinician?
Quite a lot. The doctor-patient consultation is crucial. Trust in the treating doctor and the care team is also central. Access to a trial may depend on whether the treating physician is personally involved in clinical trials or research more generally. If the physician knows about relevant studies and raises the option, the patient may learn about it. If not, the opportunity may not become visible.
That suggests that clinical trial access is not only a question of available studies, but also of who brings them into the conversation.
Exactly. A trial can exist, but the patient still has to hear about it at the right moment, in a way that is understandable and trustworthy.
How would you describe Switzerland's position compared with other countries?
Switzerland has a strong research infrastructure, and the quality of research is considered very high internationally. Switzerland conducts high-quality academic studies. At the same time, the country has a relatively small population, which can make recruitment difficult. Administrative and regulatory hurdles are also high, and this can make participation in international clinical trials more challenging. Costs are another issue, especially for academic studies.
Do patient organizations like yours use comparative data to assess trial participation locally or internationally?
From our organization's perspective, no. Our focus is on research funding and counseling cancer patients and their families. We do not conduct clinical studies ourselves, and we do not systematically compare local or international trial data.
Let us turn to patient choices and possible fears. Are there groups who participate more or less often in clinical trials?
We cannot answer this with certainty from our own data, but we would assume that participation may be influenced by age, education, health literacy, social disadvantage, and perhaps cultural factors. These are assumptions rather than evidence-based findings from our side.
What might make patients hesitant to participate in a clinical trial?
There are several possible reasons. Patients may be concerned about side effects. Some may fear being part of an experiment. Others may be uncertain about randomization and what it means not to know in advance which treatment they will receive. Additional appointments, time, travel, and effort can also be barriers. Sometimes there may simply be a lack of understanding of the trial design.
That phrase, being part of an experiment, seems important. Is that a harmful narrative?
Yes, it can be harmful when clinical trials are presented as human experiments rather than as an important contribution to medical progress. Of course, patients need clear and honest information about risks and uncertainties, but the language matters. If the public narrative creates fear or suggests that patients are being used, that can undermine trust.
In oncology, is trial participation more common than in other fields?
We assume that there are more trials and higher trial participation in oncology compared with some other disease areas. This may be because the medical need is high, especially in advanced disease or rare cancer types. There are also many new medications being developed and approved in cancer care, which increases the relevance of clinical research.
At what point in the cancer care pathway are clinical trials usually discussed?
That depends on the type of trial. For new medications, trials are often discussed at an advanced stage of the disease when standard treatment options are limited or in rare cancer types. But not all trials are about new medications. Other clinical studies, for example on de-escalation, rehabilitation, or supportive care, can take place at different disease stages and treatment phases.
So clinical trials should not automatically be seen as a last resort.
Exactly. Some trials may be relevant when standard options are limited, but others are part of improving care across the whole pathway. It is important to explain this clearly because many people associate clinical trials only with advanced disease or experimental treatment.
How do clinicians usually talk about trials with patients?
In our experience, potential study participants are usually first informed verbally by the person responsible within the study management team. That may be a clinician or a study coordinator. Ideally, these people should be skilled in communication and have a clear structure or script to follow. Written information is also required and should support the verbal explanation.
What makes those conversations helpful?
A clear structure is very important. Patients need transparent information about benefits and risks. They need a clear explanation of the study course. Non-technical language is essential. Patients also need enough time for questions, and the team should make sure that the patient has really understood the information. Voluntary participation must be made very clear.
And what can hinder trust?
Overly technical language, time pressure, and any impression that participation is compulsory. If a patient feels pushed, trust can be damaged. Participation in a clinical trial must feel like an informed and voluntary decision.
Who is responsible for ensuring that patients who might benefit are offered trial participation?
Primarily the treating physicians. But hospitals, study centers, and research groups also have a role. It should not depend only on one person, but in practice, the treating physician is often the key gatekeeper.
Let us talk about practical barriers. How important are issues such as travel, time, or income loss?
They are very relevant. Long distances to study centers can make participation difficult. Too many additional appointments compared with standard care can also discourage patients. There may be organizational challenges, such as arranging care for relatives, taking time off work, or dealing with administrative burden. Even completing too many questionnaires related to the clinical trial can become a barrier.
So accessibility is not just about information. It is also about the practical design of participation.
Yes, a trial may be medically relevant and scientifically well-designed, but if participation is too burdensome, some patients will not be able or willing to take part. Practical feasibility is part of accessibility.
How much do media and social media narratives matter?
Public debates about research can influence attitudes toward clinical research and trial participation. They can strengthen trust, but they can also create uncertainty. We cannot assess the exact extent of that influence, but the public narrative clearly matters.
What impact do clinical trials have on population health?
Clinical trials provide access to innovative treatments and are crucial for medical progress in the long term. Without clinical trials, it would be much harder to improve cancer care and develop better treatment options.
What would make it easier for healthcare professionals to make trials feel more accessible?
Healthcare professionals need more time and resources to counsel patients about clinical trials and research. Patients also need better information materials about available trials, ideally easily accessible through online platforms. In addition, the importance of clinical research should be highlighted during medical training so that doctors understand how relevant it is for future care.
What other factors influence whether patients are willing to take part?
Trust in medical research and in the institutions conducting the trial is very important. Support from family members or relatives can also play a role. Another key factor is whether patients understand the relevance of their own contribution to better medical care and progress.
That is an important point. Participation is not only about personal benefit, but also about contributing to future care.
Yes, but that contribution needs to be communicated respectfully. Patients should not feel morally pressured. They should understand why their participation matters, what the risks and benefits are, and what their rights are.
What would help create a more positive public view of clinical trials?
Transparent and better communication with patients would help. It is also important to communicate research achievements and the progress that has been made thanks to clinical research. Patient organizations should be involved because they can help translate information into patient-relevant language and bring patient concerns into the discussion.
Do positive stories matter?
Yes, positive examples can encourage participation and strengthen confidence in research. They can show that clinical trials are not abstract or distant, but part of improving real care for real people.
And what kind of message would be particularly harmful?
As mentioned earlier, it is harmful when clinical trials are framed as human experiments in a sensational or frightening way. That does not help patients make informed decisions. It increases fear rather than understanding.
Do you think the public sense of responsibility for clinical research is clear enough today?
Many people consider research important, but there is still room for improvement in understanding clinical trials. People may support research in general, but not always understand how clinical trials work, why they are needed, and how patient safety and informed consent are protected.
If you had to summarize your key message for clinical researchers, healthcare leaders, and patient organizations, what would it be?
Clinical trials need to be made visible, understandable, trustworthy, and practically accessible. Patients need clear information, time for questions, and reassurance that participation is voluntary. Healthcare professionals need resources and training to discuss trials well, and patient organizations should be involved because they can help make clinical research more understandable and more responsive to patients' real concerns.
That brings together many of the themes we are exploring: trust, communication, access, and the role of patient organizations.
Yes, clinical trials are essential for medical progress, but patients need to experience them as a meaningful and respectful option, not as something remote, confusing, or burdensome.
Thank you very much for this conversation. Your perspective shows that improving access to clinical trials is not only about building research infrastructure, it is also about relationships, language, time, trust, and the practical realities of patients' lives.
Thank you. I hope this helps to strengthen the patient perspective in discussions about clinical research.
Thank you for listening. This conversation is part of our work on trust and accessibility in clinical trials. The question we take away is, what would change if clinical trials were designed and communicated from the patient's perspective from the very beginning?